So my name is Elias Jabbour, professor of medicine at MD Anderson. So you asked me about leukemia, and I said there's no specific sign or symptoms for leukemia. What we know is for any cancer, for example, patient can have weight loss, can have fatigue, and that is not typical to any specific one. We can see it in all cancers. However, in particular, the leukemic or ALL is derived in a bone marrow, which is a source where the blood is being produced. When we have leukemia or ALL, in fact, the bone marrow is fully occupied by bad cells, leaving no room for good cells. As such, patients' elements will decrease, among them red blood cells, and we have less of red blood cells. We can have more fatigue, more shortness of breath. When we have no platelets or low platelets count, we can have a bleeding. That's why a patient with ALL can have a bleeding, can feel fatigue and tired, shortness of breath. And the third, when you have an increase of what we call the bad cells or blasts, we have no room for normal cells, the white count, which is an immune system. And patients with a weak immune system are candidates for more infection. As such, we have a fever so often or infectious sign. These are the typical signs. We see them in leukemia. Again, one of them is very specific to leukemias. When this leukemia or cancer cells start in a bone marrow, it can disseminate in the blood. It can cause the organs. It causes the lymph node to increase in size, the spleen as well, the mediastinum, and sometimes it can go to what we call extramedullary places or outside the bone marrow where the blood is being produced. Among them, two regions in the brain, what they call CNS, central nervous system, and patient can have a leukemic meningitis. And in boys or in men, we can see testis being involved. And therefore, this is a sign of leukemia. We rarely see what you call paraspinal masses or extramedullary disease, but that can be seen. So overall, nothing specific. These are signs of cancer in general, and what we call signs of marrow failure, anemia, thrombocytopenia, and of course, infections, complications, and finally increase of the blast when we do a blood test.